Under current guidelines issued by the U.S. Centers for Disease Control and Prevention, CDC, testing for hepatitis C infection is now recommended for much of the population. Among them, adults born from 1945 through 1965, without assessing their risk factors. Those with risk factors, such as getting a blood transfusion or organ transplant before July 1992, when screening methods were not as advanced. Those who injected drugs. Healthcare workers known to be exposed to hepatitis C, infected blood children born to hepatitis C virus-positive mothers. Hepatitis C is a virus that typically spreads through contact with infected blood. It also can be transmitted through sex with an infected partner, although the risk is low, and from an infected mother to her baby during delivery. The virus affects the liver, increasing the risk for a serious lifelong infection that can lead to scarring of the liver, liver cancer, and even the need for a transplant. Here, experts elaborate on 5 reasons you should consider getting the hepatitis C test now, depending on your risk factors. Point 1. If you are infected, treatments are virtually 90% effective. Treatments have improved dramatically. In years past, the main treatment for hepatitis C infection was a combination of antiviral medicines, and the side effects were bothersome and serious. The drugs didn't work well, either. However, the FDA in 2013 approved 2 new medications for hepatitis C, sofosbuvir, Sovaldi, and Cimeprevir, Olizio. The medications work about 90% of the time after a treatment course of about 12 to 24 weeks. Instead of cure, doctors talk about a sustained virologic response, or SVR. That means the virus is not detected in the blood 6 months after the medication course is stopped. It's not so scary now, with the new drugs that are out, says Sue Simon, president of the Hepatitis C Association, a nonprofit dedicated to awareness and education. Simon, now 69, had received a blood transfusion before screening. The blood for the virus was routine. She tested positive in 1991, after complaining of fatigue, a common symptom. Years of other antivirals didn't help, but a course of one of the new drugs did. Since early 2013, I've been cured, she says. Point 2. The infection can be lethal. The infection can kill you, and now you can cure it, says David Thomas, MD, professor of medicine and infectious disease specialist at Johns Hopkins University School of Medicine. It comes down to that, of every 100 people infected with hepatitis C, up to 5 will eventually die from the consequences of chronic infection, such as liver cancer or cirrhosis, according to the CDC. Point 3. Could easily be infected without knowing it. Most people don't experience symptoms after becoming infected. According to the CDC, only about 20 or 30% of those newly infected with hepatitis C have fatigue, poor appetite, jaundice, or pain in the abdomen. Even though people may not notice symptoms, their liver can be developing disease such as cirrhosis or cancer. If someone has hepatitis C and does not know it, it could be doing damage to their liver, says Michael Saag, MD, professor of medicine and director of the Center for AIDS Research at the University of Alabama at Birmingham. He is also co-chair of the Infectious Diseases Society of America's HCV Guidance Panel. What you don't know could hurt you. Related 9 facts about your liver. 4. The test is quick and simple. It's a simple blood test, Dr. Saag says. Several tests are available, according to the CDC. Some screen for the antibody to the virus. Another type detects genetic material in the virus. The test to detect antibodies should be done first, according to the CDC. If the results of that test are reactive, the test that looks for genetic material in the virus should be done next. The hepatitis C test is recommended not only by CDC, but by the U.S. Preventive Services Task Force, an independent panel of experts, and so is covered by the Affordable Care Act. Medicare covers one-time testing if ordered by a primary care doctor, and annual screening for those at high risk. Point 5. Knowing your status could help protect your partner and household members. The virus can be transmitted to sexual partners, although the risk is considered low, according to the CDC. In addition, hepatitis C is passed along during childbirth to 4 out of every 100 babies born to a hepatitis C-infected woman, the CDC notes. Within your household, sharing items that could have blood on them, such as toothbrushes or razor, may pose a risk. Knowing your status can help you take precautions.